This is the number one mistake most people make when trying to heal their gut. For those of you who are new, my name is Naria. I'm a gut specialist and registered dietitian. Do you feel you've tried everything to stop your digestive pains? Tried prebiotics, probiotics, changing your diet, removing foods, even medications, but the pain either goes away for a little bit, but then it comes back, or maybe it just doesn't go away. Let me tell you what most people are overlooking: their gut lining. And that's what we're going to talk about today: the importance on focusing on healing that gut lining to add foods back, to stop the inflammation, to stop the bloating, to allow your body to digest the foods properly, to prevent all those leaks. Let's get into that today. Think of the gut lining as a barrier or a protectant, and one of its jobs is to prevent things from crossing over to your blood, to the blood barrier. That includes toxins and even undigested food particles. It's supposed to keep all of those things in your digestive system. So when you go to the bathroom, they stay in the toilet. They are not supposed to stay in your body. But when that gut lining starts to have what's called holes or leaky gut, or intestinal permeability is really weak, then things start to cross over. And guess what? When things are crossing over and they're not supposed to, do you think your body is super excited to see the substances that are not supposed to be present? No, it detects it as a threat. And what happens? Inflammation, specifically chronic inflammation. And this is, I think, where a lot of people also get confused between chronic inflammation and acute inflammation. Acute inflammation, for the most part, your body is good. It can handle it. It is equipped. It is okay. But when you have chronic inflammation, such as those with weak intestinal permeabilities or have leaky gut, that chronic inflammation, your body's not equipped for that. Nobody is equipped for that. Just think about yourself. If you have a job and maybe you've been overworked, maybe at first you thought I could handle it for a few days, maybe even a few weeks, and maybe if you're a trooper, a few months, but eventually you probably got to the point where you said that this is it, this is enough, forget about it. Your body too, it can only handle so much. So let's say your problem is leaky gut or weak intestinal permeability. That means no matter what probiotic, prebiotic, or whatever you may try, most likely you're not going to be getting to part of that problem. And one of the steps is to find out if you have leaky gut. And after the step after is to determine, why do you have leaky gut? You see, if you're only treating symptoms, but you're not getting to that root problem, expect these issues to be there for the rest of your days. So part of your goal is to think, is intestinal permeability my problem? If so, why? Always ask your provider, your gut specialist, why am I having this? Let's review the whole story. Common symptoms that are often overlooked when someone's dealing with leaky gut includes eczema, irritability, brain fog, joint pain, and of course the regular digestive symptoms. But remember, if you're having chronic pain or chronic inflammation and it starts in your gut, eventually it's going to start to spread to other areas in your body. That's why I always tell my clients and my patients, think of your entire body. Is there a pain that I have not had answers to, received answers to? It could be migraines, and again, it could be joint pain, it could be eczema, because all of these most likely originated in your gut. Now, what are some common things or common reasons someone may have leaky gut? Now, one of the most common ones is just a food trigger. It could be dairy, it could be alcohol, processed foods, it could be gluten, and many times a temporary elimination diet may be appropriate. If you found you've done the whole elimination, you've reduced the added sugars, the processed foods, the alcohol, gluten, dairy, all those, then think, could it be a stress factor? Because remember, the gut brain connection is huge. And if you find yourself with chronic stress, guess where those thoughts are going to go? They're going to go in your gut. So many times when you have digestive issues, they may have actually originated in the mind: stress, depression, anxiety. You want to always remember, how am I feeling today? Do I feel like I've been stressed over the past few years? Because if that is so, and you've tried eliminating all those foods, that could be part of your root problem. Next one is commonly used NSAIDs like ibuprofen or even frequent use of antibiotics, but sometimes it's not even frequent. I've had actually patients who said, I've only used once or twice in my life, and the second time, forget about it. My life changed. But if you feel you've been using products like ibuprofen for a long period of time, or feel like I took an antibiotic and nothing ever went the same, that could be part of your root problem. Go back and think, when these issues started, what happened in my life? Because usually something happened, maybe something traumatic, something stressful, an infection, you went abroad. Usually something's happened that kind of gives you a little clue to why you're experiencing the symptoms you are today. And sometimes it's just because of dysbiosis or a lack of beneficial bacteria. Sometimes it's really that simple in a way, but extremely complicated at the same time. And for me in my practice, when I work with my patients, the way that I see if there's dysbiosis is by doing functional stool tests. I look at the whole picture. I look at my patient's symptoms. I do the functional stool test, and do they match? Because we want, or I want to treat the patient. Now, one of the best things I have added in my practice is not only those functional stool tests, but also other functional tests. Because again, when I work with people, I want to look at the whole picture. But if dysbiosis is real and if it's present, the test will let us know. So let's review a few things that you can try to see or determine if this is your issue. Number one, and again, you may have tried this, but if you haven't yet, I want you to try to reduce those foods that often cause inflammation and problems with individuals. That includes alcohol, dairy, processed foods, anything that really causes inflammation, and do this while increasing the amounts of anti inflammatory food, which often includes fruits, veggies, kind of like the Mediterranean type of lifestyle, unless you're having bloating after each meal or you're going through a flare up. You don't want to go crazy with fiber, and that's a whole other podcast. But for now, I want you to think, am I eating what I'm eating? Is it anti-inflammatory? Is it going to reduce my inflammation? If the answer is yes, cool. And if you're playing with the fiber game, you just have to work with your gut specialist to determine what types of fiber and how much fiber during this phase. Next, part of your anti inflammatory diet should include omega 3s. Omega 3s are so good for the gut lining. In addition, bone broth, if you can tolerate it. I get a lot of patients that actually tell me they can't tolerate bone broth, and many times they try to make it at home and they can tolerate it a little bit better. So determine if you can buy store bought, which obviously can make life a lot easier, but if not, try making it at home and see if that's better. And what I want you to do is drink every day, like maybe about 6 to 8 ounces, because again, that is very good for your gut lining. And right now, that's what we want to try to focus on. In regards to supplements, I typically recommend a product with L-glutamine or maybe just a product by itself, and also probiotics. But I don't want you to confuse when I say this, because when I recommend probiotics to my patients, it is very, very tailored. I even have or work with a company that will send the functional stool test to them, and the company will actually create a personalized probiotics for the patient. So these aren't the probiotics you may have seen at Target or Costco. I wish they work. And to be honest, sometimes they do. But with the clients or patients that I work with, usually they're dealing with a lot of digestive issues and really severe. So it's very rare that those random probiotics work. So in my case, I do recommend personalized probiotics or even like a spore form probiotics, like from the company Microbiome Labs. Usually it's going to be something like that during the healing process, and sometimes kind of like having a maintenance dose. But again, don't just go to the store and get a random probiotic. I want you to be very mindful. Look at the ingredients, think of the dosage, work with your provider so that way you can try to heal faster. Last thing, can you guess? Practice mindful stress management techniques. There is not one person on earth that can really heal their digestive system and stop those issues without being mindful of their stress. And this could be as simple as working out. For me, I love to work out when I'm stressed. Like if I am stressed and I catch myself, I will just stop what I'm doing and go running, do some type of weight training, go swimming, and I always find myself a lot calmer in a better mind space after. So I want you to think about What are you doing to reduce your stress? If the answer is nothing, start with something simple as even doing 5 minutes of deep breathing every single day. And to help, put an alarm on your phone. Yeah, put an alarm on your phone. Think of what's the best time that I have, maybe 5 minutes, put that alarm. And every time that alarm goes off, do the breathing work. And if you find that you pause the alarm or remove it, whatever you may do, on the next round, I want you to put 2, 3, 4, 5 alarms. That's right. I need you to do some deep breathing. I need you to really focus on the stress management because if you actually want to heal your gut, I'm going to tell you this is a non negotiable. Now, I want to share a client testimonial that she went through this whole process and her life totally changed. So, for this individual, she was actually dealing with digestive issues for about 20 years. And two of the foods she wanted to add back was dairy and bread. I remember her saying, Naria, I went to my primary care provider and I told them about all my digestive pains, and they said, do you want more medicine, specifically an acid reducing medication? She says, no, because I heard it's really bad for your bones, your kidneys. And she decided not to. So she found me. We started working together. So she asked Nari, how are we going to add these foods back? And of course, I can never promise anything, but my goal is always to go back to the basics and really focus on gut healing because I know if we heal the gut, we really start to be able to tolerate more foods. So I tell her specifically to get on certain probiotics, certain prebiotics to help her healing journey. It passes a few weeks and I remember, I believe it was like month 2, she comes in and she says she just starts smiling and I'm like, oh, I'm assuming that's good news. She says, Naria, I had a piece of cheese and I was okay. I was okay. She's like, I just can't believe this is happening. So then I told her to do some test trials with different dairy products and then different breads. And then I see her actually last week and she's like, Naria, I am feeling so good. And one of the things is her friends, when she started this journey, her friends said they would say, how are you going to be able to add those foods back? Like we've known you for over 10 years. Every time you have a dairy food or bread, forget about it. We don't see you for days. So she saw her friends a few days before that, before she spoke to me. She had, she didn't tell me what meal, but basically it had dairy and bread and she tolerated it. And her friends just were staring at her in awe and they asked, how did you heal your digestive system? And her face was just so good. She's like, I told you I was going to work with my gut specialist dietitian and we were going to make this happen. Guys, when I hear these good news, I mean, it just makes me so happy. I love what I do. And this is honestly one of the best things because now when she goes out, she doesn't have to worry about the bloating or feeling like she looks pregnant, uncomfortable, or leave an event early or go to urgent care or be scared when she's traveling. Now she sees that we're working on the leaky gut that she had, and those holes are starting to be closed, so that inflammation is starting to go down. Her body's better able to tolerate foods. Guys, this works. Approach it the right way. If you've tried an approach before and you found that didn't really work, you may have to tweak something or try a totally different approach. Now, if you've tried all these things and you still have digestive issues, frequent bloating, acid reflux, contact me. I'd love to hear about your case. Send me an email at narialemaire, NLN@gmail.com, or comment below. And for those of you who haven't tried any of these, try them and comment and let me know if it worked. Now, I know I have a lot of new followers, so if you haven't received my free gut restoration training, I'm going to put the link below so you can see what the 3 steps are that I take with all of my clients to heal their gut and stop the pain. Thanks for watching, and don't forget to comment, subscribe, and share with anyone you feel may benefit from this episode. All right, friends, till next time. Bye.